Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
She's been a colleague, but she's been a friend, TERE Rodriguez, and she's within a fabulous organization. Oh, he's not. Good morning, everyone. Thanks for joining us again. I'm so happy to be here with TERE Rodriguez, who's been a friend, an associate. She's someone who works for an organization where I adore their doctors. And let me just tell you 1 second before I introduce TERE Rodriguez. She's the office manager for South Florida ENT Associates. I have had a great experience there for many, many years. When my husband was alive, he bought his hearing aids there, and they were superb, and I always go there for my ears to be cleaned. And Dr. Shapiro and Dr. Juropsi, are just special. You know, whenever you go to them, you'll see their office mobbed. And the reason is because people feel that. Everyone that goes there feels something very special. They're not just a number. Even though you have a very large patient load, it seems that everybody cares, especially your receptionist, everyone, TERE. And I know that's all your fault, and I have to say that I know that. Not everybody has an organized office. And I have to appreciate you for what you've done over the years. So now I'm going to let you talk, because you certainly have so much to say about people's hearing health. You know, they're otolaryngologists. That's a big, long word.
So first of all, thank you for having me here this morning. Thank you for all those compliments about my office. Yes, it is a practice been established about more than 26 years ago. Dr. Shapiro and I started the practice long time ago. But we always have the best interest for the patient. We look for people when we have people join our team. We make sure that they care, because if they care, it goes down the line to everybody. So yes, you feel when you walk into my office, you feel special, but it's because everyone that is working with us, we are a team. We care for.
Well, one thing I knew, I had been in the hearing health business before I met you, and I recognized real experts and real good people. And ever since I've come there, not because I've needed hearing aids yet, but because my husband did, you were very specific and very particular. You would have someone, if they didn't do everything the way you thought they should have patients, they were gone. I mean, I know that,
yes.
But you had people then for years, and I watched them when they dealt with, people with hearing aids are, they're sometimes they don't understand properly. It's not easy because it's very technical, but your people make it very easy. And I know you have a new hearing health person there.
Yes, but let me go back about the hearing thing.
Go back.
One of the things that when you say about hearing that we did in our practice, I did it one day, is that to make people relate to what patients are coming. I mean, our practice is not only hearing, but it's many other aspects of ear, nose, and throat. But since we're talking about hearing, one of the things that I did once to all our employees, and I'll do it for the new ones they come, I actually give them earplugs. And I have them put earplugs and work in the office for half a day or sometimes a full day with earplugs. And the reason I did that is so they can relate when patients come to the office. If the patients are screaming to you, it's not because they want to scream to us. It's for the simple fact that they can't hear. And the same thing with their family members. People cannot relate the issues that people with hearing loss have unless you are in that setting. So that's what I did with my staff. So when you say about how the staff cares or relates, is because I actually have done that.
I don't think anybody's ever done that. You're
I
so
don't know
good.
if somebody else, but I'm kind of come up with
I
these
love
ideas
it. That's wonderful.
to do that. So that's what we do.
So, Dr. Shapiro was on the show recently, and he, of course, loves new ideas in medicine to do with hearing, right, and nose, ear, and throat. Actually, yes. I dwelled on hearing because that's been my particular experience with your organization. And also I only have your Dr. Juropsi is the only person, of course, because Dr. Shapiro is doing other things with other people, clean my ears. And people think, why do you drive all the way to Pembroke? Because I want to have an expert do it. I want to make sure when he looks at my ears, there's nothing wrong.
Exactly. And it's the thing is with we have a lot of patients that come for they clear the ears. I think you have to go to a professional. The ears clean themselves. Pretty much our organisms start to push the wax out. And what people are doing in some cases is that they're actually introducing things into the ear to clean their ear, and they go too far into the ear canal. So you have wax build out. The wax start pushing themselves out to the outer through your ear, and that's when you need to get either a little towel or a Q-tip even and go around the ear to clean. But you don't introduce that inside the ear canal. We had some situations where a patient put a pin, a key into the ear.
No.
Yes.
For what purpose? To clean it?
To clean it.
Oh
because
my
they
God.
actually put a key inside, and some person got stuck on it. We had another ones, they use bobby pins. That in the old times they used to do bobby pins, and they're still using those bobby pins. People introduce that, and they can actually damage the whole eardrum. I mean, it gets really, it's not good. So they do that.
I go every 6 months. I want to give you a phone number also. Write this down. Remember, this is Pencil Talk Radio, 954-438-7171. 954-438-7171. And this is the place for you to go. And whether you have a child or you have a grandma, that's right, all ages to sit there.
All
It's
ages
so
are
cute. I
welcome.
know it. But let's now talk about some things that you can help with hearing or ears.
Well, let me talk a little bit also about wax. And I'm going to talk a little bit about wax because a lot of people think, oh my God, I'm having wax in the ear. This is not good, blah, blah, blah. But the reality is that the wax is created to protect your ear, to protect your ear. So what happened is that it is to protect for any dust particles, for anything that it can go into your ear. And that's why the wax is good. Excess wax is not good. And one of the reasons you don't want to use a Q-tip or anything is to push that wax inside the ear, and it can get impacted. So that's why you do have to go to a professional when you have excess of wax.
Okay, so I must have excess of wax because I want my ear to be protected. They take out the excess, but this is still...
They leave a little bit because it's producing every day. The wax is produced every day.
And as we age, do we produce more?
Some people do. Sometimes it's hormonal. Sometimes it's anything. Yes, they do produce. They say they produce more.
Well,
but some people don't. I guess it's the body. We have patients that every 2 months they're going for ear cleaning. So it's the body's reaction to your thing.
Okay, so we've covered that, and I'm so glad that so many people use those Q-tips for that, and I'm so glad you explained Q-tips for around the ear, not in the ear canal.
No in the ear canal, no keys, no bobby pins, no needles. I had somebody who called me a couple days ago that they had a needle in there. I don't know how a needle got in there, and they couldn't explain, so I'm assuming they just tried to remove that wax, Another thing that I want to talk a little bit is about ear infections. A lot of people are having ear infections.
How do you know you have an ear infection?
Oh, that's a good question. Normally, they're infections because you have pain in your ear, especially when you are laying down, because the pressure goes into your ear and you have this severe pain. Sometimes you have discharge from your ear. Sometimes you have dizziness. Sometimes you have temperature. That's one of the things that you can have, especially the pain. When you have it because of the pain and the pressure.
But wait, go back to the if you feel dizzy, like when you get up from your bed, could that be something?
It could be because you have pressure in your ear. So that's the whole balance system. It becomes something within your ear. So when you have that pressure, it makes you dizzy too.
Well, it's very good that you mentioned that because there are people who fall all the time. And maybe they need to go because their balance is bad.
They have to go and see, and it goes hand to hand with a neurologist. But the majority of the patients, normally the first thing they go is to an ENT, to an ear, nose, and throat doctor. Why? Because we do check that first, and we clear that check first before they go into the neurologist. So that's what we do.
And so, how do people find you? Are they the referrals from other doctors to you?
Well, it's funny. Some people find us in social media. We are in social media. It is amazing to see the new generation, how they go to social media and find us, and they come and call us, and I thank people for that. And referring to doctors. And we have patients that are being our patients for so long that they refer to their friends, their families, and their family members and so on. But we have generations. I mean, I not too long ago I saw a baby that now is in college. I'm like, oh my God,
But you're looking good for that.
And we have the babies of the babies, right. So it's like we're getting up there. So it's the word of mouth. Patient referrals, especially, are always great to us, and they're loyal patients because we're loyal to our patients.
Yes.
And in the same token, we have a lot of physicians who refer. We have a lot of physicians out of patients.
Yeah, I'm sure you do. So one thing that's been exciting is when I first met you, you were in the same place in an office, but now it's huge. So what did you do? You just had so much more business.
Well, we added more services also. See, when we started, we have a little office and we start growing and we start getting more staff, we start getting more patients, but we're trying to do always the one-stop shop. Right. That was always been our concept. That when the grandma brings their grandkid, for tonsil, the grandma wants to have their ears cleaned, or might want to have might need the need of a hearing aid. Or the mom with the daughter. Mom brings the child for an allergy treatment, and the mom needs something to do with her sinuses. So it is one-stop shop. So we have created auxiliary services also. So we have the allergy department, who has grown tremendously. We have the latest things in allergies in our office, in our practice. Dr. Jurab, she's actually board certified. He had a fellowship in allergies. So he's a very expert. It's kind of his passion, one of the passions, sinuses and allergies. And our allergy department has grown immensely. We have the hearing department, which is anything to do with hearing, balancing, and hearing aids.
But you brought up the allergy. I'm glad you did that, because I have friends that they're sick. They always say, I have allergies, I have allergies. So why don't they get them taken care of?
Yes, because I sometimes wonder, and I guess it's to get to, a lot of people think that just the allergy is the shots, and people don't like shots. And that's why I guess one of the myths that people don't want, or the reasons why people don't want to do allergy treatment, because they say, they're going to find everything and they're going to give me shots. But not necessarily they do shots on patients. Some allergies can be treated just with a nasal spray. Like there is new allergy treatments that you don't need shots. You just need it's drops that you take once every month for the allergy treatment. And one of the things that I think is very neat is that one of the physicians are doing this type of allergy test that is for any creams. Any creams that suntan lotion, stuff like that,
that's
shampoos.
Right. So they're allergic to certain things.
Yeah, I have a friend that she turned white around the age of 45, and one day I said, "Why you didn't, why don't you color hair? You're so pretty, we women think about that." And she actually had a severe reaction to the color of, and she cannot use any hair color product.
Oh, really?
And she
needs a wig.
She wears her braids very nicely.
Yeah, right.
So and they did this test on her for as a result came that the products that there is a product that the hair color has that provokes terrible allergies.
Getting back to the allergy, when Dr. Jarabchi was on my show, he did an extraordinary discussion on this new sinus operation that he does for people.
Well, he has few.
Yeah, he
has few. He's his passion. He wants to make sure that people are taken care of. There's a lot of sinus surgeries and a lot of sinus techniques, and every day is something new that is coming, which is great. And he looks for the best technique for the patients, because not every sinus and not every patient is the same. So I'm assuming that he might talk to you about the balloon sinuplasty.
He did.
He might talk about the Clarifix, or those procedures that they have out there. But the reality is not everything is for the same person. So he actually looks into the patient's conditions, and that's the best thing.
And now you can actually do those procedures in your office, can't you?
Yes, we have. We can do some of them in the office. The
so
majority can be done in the office. Yes.
So that's what you did when you made that new side. Is that for the allergy?
Yes. We created that because it was hand to hand with allergy, and with those sinus procedures, it's a process. It's not the patient comes to the office and here you go, you're having this huge surgery done. There is a process because the insurance, unfortunately, we are tied to our insurance companies. They do have guidelines and requirements. So people has to be in certain antibiotics, nasal sprays.
Try everything they can first, right?
Before they approve for a surgery. But once that surgery is approved, it can be done in the office or in the operating room. Office is a lot better because you go there and it's a local anesthesia. You go in and you are out and you have no problem. The problem in the OR, in the operating room, is you have to do the whole process, spending pretty much the whole day in the hospital until you get out. It's an outside person.
And I think you're also taking care. There's some new things there for people who snore.
Yes, you had Dr. Shapiro here.
Oh yeah.
Yes, he has a new procedure for people that snore, and that's a great procedure. I saw the patient not too long ago.
Tell us about what happens.
Well, there's a procedure that there is an implant that it goes into your rib cage and it goes all the way to your, I think, the base of the tongue. And what happens is that when people start to snore, especially people that they have severe sleep apnea, that they can't breathe and they stop breathing. So it sends this signal that makes the tongue and the body to react to that. And it is a procedure. That's in the operating room, and it takes time because they put this implant in there, and it has to wait about a few weeks before to make sure that everything is functioning and everything heals, and then it's activated. And
don't have to mask or anything.
No more masks, no problems. I had this patient, and he was so happy. The wife was thrilled. Because those masks, the wife went back to. No. The wife went back to her room to sleep. They used to sleep in separate rooms.
It's almost like you're sleeping with a monster,
exactly.
Even though, right.
Well, yeah.
In a sense, and now with all these people, dating young people, can you imagine all of a sudden, I can't sleep with you because you won't believe what I have to do, right?
Yes, especially the mask and the sound and the noise, and it is good. This patient is thrilled. As a matter of fact, we're doing a segment eventually about after the fact, and you probably hear about that.
Oh, it sounds I have never heard until he got on and said that. I couldn't believe it. So this is pretty new.
It's pretty new. Yes, he's pretty new. He is, Dr. Shapiro and Dr. Jurabchi both like to be into the latest technology, and people approach them and to try new things or look at new things. They're very picky. They don't try everything that comes. If you see anything that comes through my office of new stuff that is coming, and sometimes you wonder, I'm like, no, we don't want to try that. But they like to try new things, and especially things that they don't do anything unless they know that it's going to work.
Well, I am so glad you're here because, when they come on, they're talking about a specific thing. And I love you because you're the generalist. You know what's going on. It doesn't get by you. And really, it must be wonderful for you to have this kind of experience. When you first started, you were just you were in kindergarten.
One of the things that we do when we were talking about allergies that I want to mention is that we have a lot of college kids that they come in during the seasons and they have allergies, and we do help a lot of those college kids too, because they come here, they're treating for allergies. Some of them goes to a different state. Allergies are different. Colleges don't want to deal with because you are going with a college nurse. So what we do is we treat them in a way that it can be in Florida and in another state. And we help them through the transition, through the nurses and all the medications need to be. Something people don't think about. But
no, I
have a friend from New York, and my daughter's best friend, she has allergies, but the allergies here are different than one from New York, and she misses school a lot because of that. And we start treating her.
So tell me what, and because I don't have any allergies, what happens when you have an allergy? What, sneezing or eyes burning? Or
I wish it was only sneezing. Because the sneezing, you deal with it, but some people get it. It's not only continuous sneezing, but also they do. They get a lot of discharge from their noses, and then have sinus infections. It's a huge combination, but they get some that they cannot get at home. It's like a bad cold, but it's not a cold. It's just allergies. So
how do they know if it's an allergy or a cold?
Through the allergy test. Normally they do an allergy test and they see why. I have a friend that it was she had this house built, and she put these royal palms, huge royal palms. She started feeling very sick, and one day she called me, I have this cold. I've been having a cough and a cold. It's not going away. So came to see us, and my boss, Dr. Shapiro, requested a allergy test. Here comes the allergy test results. And I remember us calling her and telling her, those royal palms that you have back there?
You're kidding.
To remove them. The royal palms.
And
were
how
green.
does the test know that? I mean, that's just
Because we do tests. What is the most common allergies in Florida, in South Florida? So normally it's palm, weed, dust mites are very common. So we go through that panel, but we also ask the patient what is their environment, what are they in, to add into that allergy test other environmental things that could affect them. If they have food allergies, what do they eat? So that's how we do it. Mm-hmm.
Oh, this is brilliant. I'm so glad that you've come today. She drove all the way up from Pembroke Pines. So this is TERE Rodriguez. She's the office manager of South Florida ENT Associates. And the phone number is 954-438-7171. I have to be very strong with my listeners. If you're having any problems like we've been talking about, don't just go find any physician. Go here, because I have a lot of experience with them, and I can't recommend them more highly. They are first class, and TERE isn't going to let isn't going to let anything happen that won't be perfect for you. She's a little crazy that way. I mean, she is.
Yes.
I know you are. You're like a mad woman about everything has to be exactly right, and I've seen that with you. And she has such nice people there. But TERE, in passing along, so the most important thing that you've said in a sense about your clientele, your patients, they start from infants.
Yes.
And they go all the way up to people in
102.
102.
And
well,
she was driving.
Oh, you see,
I was looking in the parking lot through the window.
Right, she's been in good care with you, and we thank you for coming in this morning. It's been a great show, and we thank you so much, TERE. And we'll be back next week. Don't forget to go to the Boomer Expo on Tuesday, the 28th, over there at Seminole Casino. Goodbye.